My Yeah, I'm fine with George. My youngest son was an oops baby. I didn't want to have a child until I was 30. And when I did become 30, I thought, you know what? I I want a little girl. I let him convince me to go off and um got pregnant and had a miscarriage very early on because of Depakote. I was still, I think, it was like in between the first and second trimester. So early, it, they said it'll be nothing but a heavy period. Yeah, no, it was
Mm.
more than a heavy period. And I cannot imagine getting an IUD. You are brave.
I just
I
don't know if
have
it's
the
gonna
arm thingamabobber. Actually, you could see it maybe. It pokes.
Mhm.
So for this pregnancy, I know you mentioned oops baby. Was that the one when you were on the Depakote?
Yes.
Oh, okay. So no medical professional would have,
Wait, no, I was not
went
on
over.
Depakote for him. I didn't get on Depakote until after I was on the seizures. I had at that point I was on Adderall and give me a moment. My dad's calling. Yes.
Okay. So yeah, that would definitely be concerning. Depakote is one that's very well known for significant risks and potential harm to the developing fetus. That's pretty much where we ended up with the Carbatrol when I was on Carb. Yeah, it was definitely Carbatrol, the extended release, and that's well known to reduce the efficacy of Depo, and that's pretty much what my conclusion was led to that ectopic pregnancy.
I was on Keppra when I had my kids. They said that that was the safest one of all the meds for having a kid. And for my first kid, they said I couldn't breastfeed. And that was in 2011 because of the Keppra. And then when my daughter was born in 2014, they said that I could. So I don't know if it was different doctors or different research came out in between there where they were like, okay, it's safe now. But I don't know. That just shows you how it changes their information throughout.
Yeah, and it's not uncommon to hear that doctors change their recommendations.
Mm.
Sometimes due to anecdotes, how the patients they've treated, as well as research that's being done. So the Keppra, though, that's one of the ones that's known for kind of a standard higher dose. Did your dose change in between
I was on a low, at that time, I was on a lower dose.
in 14?
Uh, yeah, I would think I was taking like the minimum dose really, and it was controlling my seizures. They've just, as I've gotten older, they've gotten a little bit worse and worse. A lot of my problems when I was younger was like missing meds, drinking. So then I quit drinking, and then I stopped missing my meds. I got religious about my meds. And then I was like doing all the things that were like taking care of all my triggers. And then, like, within these past 3 years, my seizures have gotten really bad. And it's definitely because perimenopause. Like, I was having maybe one seizure a year. On a bad year, it'd be like two, but usually that was because I didn't take my meds or something dumb,
Yeah,
just being a dumb epilepsy person. And
it happens.
but now I'm like religious about everything, and I just keep having more and more seizures since 2023.
Anyone ever
And
mentioned medication resistance to you?
no, because they're all pretty much they're related to my period. They didn't diagnose me with catamenial. I can't say that. at the beginning, but they and even one of my doctors was like, "Oh, that's not a thing." And I was like, "You're dumb. I know it's a thing, but whatever." And then they were all related to my cycle. Like you can just tell like
Yeah, once
and
that trend is established, it is frustrating though how once that trend is established, the doctor will write off any other triggers. That's
mm,
where I feel a lot more emphasis than should be is placed on catamenial seizures when obviously there are still other triggers. Maybe the that time of the month, the day, couple days before and couple days after is when my threshold is lower. You know, that was a stupid day to drive into the mountains, but we did. And that's why I don't call last week's tonic-clonic just catamenial. You know, usually I would have focals. I'm more likely to have focals around those couple of days. It wouldn't have completely generalized on, you know, pretty much any other given month. So that's what has me curious too when I go to see a physician. I think we should all ask more, you know, almost give them the hypothetical situation. Do you think I would have a seizure if, you know, and then we'll bring up the that time of the month and travel or something else and see if the doctor would be so quickly to write it off as, oh, on that time of the month, just don't travel. Or if they would come up with a suggestion of working with your hormones. Some of the doctors are saying that influencing hormones by, you know, taking other supplements really do make a difference. And they mess with that AEDs and benzos so much. I'm surprised they don't really try to get to the cause and work
mm.
with those factors more frequently.
My doctors typically write me off when I talk about my seizures being in accordance with my periods. They're just like, okay, whatever, and then just move along. Um, we're military, we move around a lot, so I don't always have as much choice in my doctors who they are. And but I will say, well, I just have tonic clonics. That's what I get. And I haven't had my period in 2 months, and I haven't had a seizure in 2 months. So that's kind of crazy.
And you can show them like the tracking that it like matches up with your period and the seizures, and they still are not believing you.
Hi,
Um,
friends.
they just blow me off all the time. Doesn't matter what I say. I have a bad doctor and I'm getting a new one. So I just have to wait a few months to get to see.
Yeah,
But
no, I believe you. My first two neurologists are horrible, but
yeah.
I mean, with the move and everything that's going on, that's what's got me committed to actually finding an epileptologist. Never had one of those before. I'm
Okay,
thinking
I'm
somebody
so
who's
sorry
actually a
about that.
specialist. They might know what they're
I
talking about.
cannot. Hi. Hi.
Hey, Hannah, can you hear us okay?
hi.
Yes, now I can.
Excellent.
Didn't know things like this were out there. I fucking love Reddit.
Beautiful. Well, this is the first event. Just so you know, you are definitely in the original crew here.
Oh, cool.
But
Um,
not gonna be the last.
I had
Exactly.
I've never really been in anything like this before, but I heard um kind of what you guys were talking about, that you were being blown off. And my when I was diagnosed at 14 years old. Actually, no, wait, was it? It was puberty. It was puberty. That's when I was diagnosed. And that's when that was the worst of it. And then it always was with my cycle, and typically at night, things like that. Got the whole SUDEP thing, and they're all the tonic clonics. But from there, I I started researching medical things a lot because of all of that. And then I ended up going into nursing. So I'm a nursing student at the moment. Um, but from what I've found in the research is that there's so little that they know about what causes the seizures. Most of the time, they can't even figure out what's causing that seizure to happen, what effects the seizures are having on the brain. So the doctors, I think, because they don't have the knowledge, they can only do so much, that it sometimes comes off and some doctors are just assholes about it, and they're just like, all right, you're wasting my time, like I have another patient that I need to see in 10 minutes, get to the point. But I think that because there's just so little that they know that is known, and so little that they can do, they don't even know how these how the seizure meds work. They don't, any of the seizure treatments, they don't know how they work. They're throwing stones at a wall and they're seeing what hits. So, I mean, it took me a long time to get over that too, because I thought that I was not being believed. And that was a big trigger point for me for a long time. But the deeper I got into the profession, it kind of just helped me not take it so personally.
Well, and
That's powerful.
the doctors, and I think especially the neurologists, they come off as so arrogant, and I think they might be very arrogant, and they have such a hard time admitting they don't know everything. And this one neurologist I went into, I came into her with a cup of drippings from my nose, the CSF drops, and from the ENT doctor that I had been to the day before. He told me to bring him into the neurologist. She refused to test them, and I started crying. I knew I had a CSF leak. She refused to test them. I started crying, and I was in there with a friend. And she said, and she was caught off guard. She's like, why the F are you crying? She didn't say that, but I could tell by her face. And so then she looked at me and she said, I have never heard of she asked me questions. She said, did you bonk your head? Do you have a skull fracture? And I said, no. And she said, I have never heard of a spontaneous CSF leaking out of a nose if you don't have a skull fracture. And then we went through the rest of our appointment, and she said, this was May. She said, I'll see you in August. And she scheduled me for an August appointment. I had in my chart, I had in my chart that the next day the ENT doctor had scheduled me for an MRI an MRI for a suspected CSF leak. She did not even look in my chart.
I think there's something about medicine and healthcare as a profession that brings out the assery in everybody. Like the asshole tolerance, it just drops for some reason. I don't know. I mean, they're throwing my epilepsy doctor, I had a bunch of shitty ones. And then eventually they sent me over to UT Southwestern. They have like the whole epilepsy center, epileptologists, things like that. And they have 4,000 patients for 4 doctors.
No.
When I first met my doctor in 2018, maybe, he was like, he looked like fresh off residency, so perky, like super sweet, had a little tie going. And now he has the beard, the bags. Like 5 years later, he is just gone. So I think for some reason, the deeper you get into the medical profession, it'll bring out the assholes out of people. Some doctors are just complete assholes. Like when I had my surgery, does anyone have an RNS? Do you guys know what that is? So I got my RNS in December, and when I came out of it, I was in like, that was the worst pain of my life, and I have been in a shit ton of pain. And they're like, I don't know, it's not supposed to be this painful. And I was expecting pain because it's brain surgery. And I'm like, there's something wrong. I'm in way too high of pain. What's going on? And I thought that they weren't hearing me. And I thought that they weren't listening. I thought at the time, I thought they just didn't believe me. And they weren't giving me any sort of pain meds, anything like that. And later I find out when I'm looking at something on my chart months later that I had swelling in my brain from the surgery, after the surgery, and that was the pain that I was feeling. And the reason they weren't giving me narcotics is because narcotics make the swelling worse, so they couldn't give me the meds. No one thought to tell me this. So
So
I
you were
thought,
under the impression that you were going to actually have something to help with the pain, and nobody told you that it's once the anesthesia wears off.
yeah, I was under the impression no one believed me. And it's those little things, because they're not spending the time to explain things to people. That's what makes them think, oh, well, my doctor fucking hates me, because they're not treating us like, hey, we're people, talk to me, They don't have the fucking time to do that anymore.
So this is the same practice that has that volume of patients to 4 providers. Or
I mean,
you said it was like 4,000 patients or something ridiculous.
it's like 4,000 patients, but there are 4 epileptologists, and then they have the mid-levels that monitor, and then but they're inpatient and outpatient. So 4,000 people outpatient. Most of them just have to get refills of meds, but the more complicated ones will go in the EMU, and then for all the mid-levels kind of just monitor, and then the ones that are like having serious difficulties, those are the ones that see the doctors. But that's because I'm with a research hospital. I tried like 6 or 7 different doctors, and they took one look at my EKG or EEG, and then they just like got scared and ran away.
What's up, Toaster?
What was that?
Oh, Toaster had her
Can
hand up. It sounded like she had something to add.
Yeah,
That's
actually, it's a question.
ridiculous.
I hope you don't find it as invasive. What research hospital?
It's UT Southwestern
UT
in Texas.
Southwestern. I hope this doesn't make me drop. Give me a moment. Texas?
Yeah, it's UT Southwestern. UTSW is what you want to search. They're like one of the bigger hospitals in Texas.
So overall, I mean, I know this is pretty new. Did they turn on your RNS? I know after a few months after my surgery, they didn't actually turn it
Holy
on
shit.
for a couple months.
Supposedly it's a level 4, but I don't believe that.
Yeah, it is.
Not after what I heard.
UT Southwest is great. They are a great hospital, but they are so, I mean,
Inundated
they're
with
the
people.
only, they don't, yeah, there's like one of the only ones in Texas that are level 4. So
Well, and I have to say that, so I'm in Seattle, and we're just getting
Wait, this looks
inundated.
familiar. I've looked this up before.
yeah, they're good.
And
Yeah, yeah, I think I've looked this up before.
well, I was going to ask, like, has that level of the ratio of patients to doctors, has that gotten worse in the past few years?
Um, Not really, because most of their patients, they don't make appointments with. Like, most of their patients are the kind of epilepsy that doesn't really need to be monitored as closely. They probably have maybe 10% of them that they're actually closely seeing all the time. So they just have like that many people within their system, but they're all over the country.
Okay. Sorry, this is starting to make a little bit more sense.
Still, my
This is going to sound
my
weird.
doctor still looks like he just got out of prison, though. Just because he went from like really preppy looking adorable guy to just got married, sort of cute little guy, and now he looks like he just got out of prison.
Well, that's great that you can actually remember that, have that memory to compare it to.
Well, I've been working with them for a long time.
Okay.
Long time.
Oh,
I
okay.
mean, I
So
spent a
that
lot
helps. This
of
was
time in
before the
hospitals.
RNS process.
Oh yeah, because I've
Okay.
taken over 20 drugs, 20 different drugs. I have the VNS here as well. And to
Wow.
answer your question, is it Kate?
Kate or Katie?
Hi, Kate. Okay. So for the RNS, I got it done in December. And in December, I was probably having, at that time, maybe 2 or 3 tonic-clonics a month, but they would last up to like 5 minutes a piece. And then I got the surgery. And then I didn't have a fucking single seizure until last Friday.
And you're saying the RNS, you're crediting that to the RNS or more the VNS?
They haven't turned it on.
Right. Okay. So that's more the VNS
I
actually doing its
haven't,
job.
just the surgery, just getting it implanted. I hadn't had a seizure for like 8 months.
Wow.
And they haven't turned it on yet. And they're just about to turn it on because I just got that seizure, so they know how to do it.
Okay. Okay. So that RNS, once
I
the
was in the
electrodes are in there, that
learning
was
mode.
right.
It
Okay.
needed
Now
to
I remember.
record the seizure so that they know how to stimulate.
Oh
But
yeah. They love playing with those settings. Do you
so
have the
that'll be
RNS
fun.
tech and the doctor in the room when you go to your RNS appointments?
Yes.
Yeah.
And it's
That's a pretty
annoying
typical.
because for some, like, anytime I say something like, oh, well, yeah, it took a little, like, complain about the tablet or something, she sent me a brand new fucking tablet and it's still sitting there in, like, the back of my room, still unopened. Like, I'm not gonna open that. I'm probably just gonna bring it to the appointment and give it back to her.
Yeah, they get really strict about those data transfers. Are you guys familiar with how RNS works? I don't think I've ever explained this before in the after depending on no, actually I think it's with all the electrodes. Did they give you those depth electrodes, the rods that go in, or did they do the topical ones? Do you know what
They
kind of
did both.
electrodes you got? Oh, okay, you got
They
both.
did 2 depth on either side, and then they
Mhm.
did the little thing on top.
Right. The device right here. Okay,
Yeah.
yeah. So that's the same electrodes that I got. And what the why RNS is so strict about data transfers is that apparently these are supposed to be recording brain activity 24/7, but the stimulation only occurs when the activity shows seizures. So they have this magnet that they asked me, and I think of that as like a bookmark for the tech, because that'll just like make all the spikes go out of whack and it'll show them where I think I had a seizure. And that's the ones that they, from what I can tell, if they see that my version of a seizure corresponds with like a certain pulse, then they'll adjust the settings to either like make that stimulation longer or happen earlier or more powerful.
Oh.
There's a lot of things they can play with, but that's why they're really strict about us doing data transfers every day, so that maybe somebody has a chance of like studying this data before we show up for the appointment. Over time, that's proven less and less effective with me. They just don't
Yeah,
talk
I do
anymore,
it maybe
and
once a
yeah.
week. If I do it once a week, I feel proud of myself. So, but it's all right. You did say something. Can you move? You're like in my way, bro. Um, you said something pretty, cuz have you guys, any of you been diagnosed with the psychogenic seizures?
Misdiagnosed is what we hear a lot.
Yes, exactly. And it's always when they're trying to figure out if you're getting auras or not.
And that's enough for them to give you some kind of starter med, say try this and we'll talk.
Well, because technically an aura is a seizure in itself, right?
Yes.
So they say,
Partial
okay,
seizure.
well, we got to figure out if you have auras. So they put you up in the EMU. They tell you to press the button if you feel weird. You press the button, or you tell the nurse, yeah, I might be a little nauseous. She presses the button. And then they're like, oh, yeah, well, you didn't have a seizure, but your button was pressed. So you have psychogenic seizures. That's what's making you feel weird. I'm like, well, I mean, you could have told me, like, hey, what am I supposed to be feeling? What is weird? You know, like what am I? What, it pissed me off. That's psychogenic, and now they are forcing me to see this psychiatrist that specializes in epilepsy, and he costs like $200 a month. And the only thing he does for me, he prescribes me Adderall. It's the only thing he does. This epilepsy yeah, that's the only thing he does.
So do
I'm
you
gonna
feel like this
bust.
psychiatrist is actually contributing anything to your care?
Adderall.
But that's what I mean. Do you actually use the Adderall, that because Adderall is a stimulant?
Oh yeah. I
So
use
that's
I use the Adderall.
kind of
I mean, I
risky.
do have to be careful because there are some times where I'm feeling like if I'm feeling strange, I'm not going to take it because they can cause the seizures, but they're not like they do help function in between for sure. I've just had to I mean, I'm sure all of you have gotten to really good at kind of reading your own body and what is feeling weird and, you know,
Versus aura.
like that because you
The
can't
thing
ask
is, with me,
anybody
I've never
else.
gotten auras.
I I one of the best doctors. I only had him for a short period of time. Um, because my husband ran him off and well, ran off his mouth, and shortly after we got a letter saying, yeah, no. But the first time I met him, he said, "You know your body best." Because I was going in there prepared to explain why I'm on Ambien and Seroquel
Yeah.
and all of these epilepsy medications because I wasn't in with Duke at that moment. And he said, You know your history. I don't." And it's like, oh my God, thank you.
That's generally not how most doctors think.
No,
And
no.
that's a rarity.
Um, but before that, I have um both diagnosis, psychogenic or yeah, psychogenic non-epileptic seizures, PNES, and epileptic. Both. 30% of epileptics will have PNES, and vice versa. No, the vice versa is the autism. Never mind. But the
Uh,
30% I am sure of because I remember
I
Dr.
think
Lundy
a
telling
lot of
me.
people have been misdiagnosed with that. Granted, I'm sure it's a real thing. I'm
Oh,
not
yes.
denying that it's a real thing, but I definitely think that they jump too quick to conclusions with that
Oh,
particular
that I
diagnosis.
agree with. Oh, definitely, I agree with. One of our friends was battling that forever. She recently just got her victory.
Um, I did want to ask, does anybody in the group have any children? You guys are all moms? Oh, biological?
Both.
Are you guys terrified of puberty?
Yes and no. I've gone through it with my older kids, so the youngest should follow the same way. That being said, oh great, you want me go? You- Never mind. I trauma dumped this on Katie yesterday. Don't want to go into it
You
again,
think I remember?
and that's why I did it.
We make good support because we don't remember what you said the next day.
That
And we
is
love
why
you
I
all the
take
same.
notes. Notes for everything.
Between that and my weed addiction, then yes, my brain is gone.
Um, so before Bill Cosby went weird, they had a joke about children and how all children are brain damaged. It fits children and their parents to a T, believe it or not. Or at least at the
I
us.
Did any of you had like seizures while you were pregnant?
No.
My tonic-clonics got longer and more severe every trimester, along
How-
with like the major hormonal shifts of like when breastfeeding started and stopped, and
So and
Well,
your
yes.
seizures are hormonally.
clearly catamenial.
Yeah.
Yes, since
Because
high
Yes,
school,
mine
and
are
never had
too.
no.
auras.
That terrifies me. What happened?
The first pregnancy, the first thing you asked about puberty. Not completely terrified. Daughter's 14. I'm just trying to get her to open up and talk to me about birth control so she can know the reality of, what's actually out there before you're even active. Just know what you're going to be told. But regardless, she's been through puberty and nothing obvious. We all know the signs to watch out for focals and, obviously generalized. So she's well aware. She'll remind me pretty consistently how many times she saved my life, and she'll, check pupils and know what to do. But not terrified about puberty as much as, it used to be more pregnancies. After the ectopic pregnancy, wasn't aware that Depo wasn't going to work with the medication I was on, because they don't tell you that. And way worse cramps than usual. They went ahead and did the ultrasound and said, you just had a miscarriage, so we got to get you booked. Or not like I'm getting arrested, but we'll get you inpatient. Oh, I hope they
Hold
edit
up.
that out.
That
That's what it felt
that's
like, though.
pretty much the reason I'm here right now, is because I've always wanted kids, and I'm getting married, and never thought I would be able to have children of my own. Just the thought of me being pregnant and having a seizure, and the risk to that, or the risk of giving a child and passing along the seizures, or the risk of me having a seizure in front of my child and traumatizing my child. And that just is in my head 24/7. And I'm just like, I don't know what to do with it. I mean, it's not something you can, there's no solution. There's no solution to it besides I either put up with it or don't have kids. And shit, my medication is like $200 a month. How would I even afford kids? Ugh. Anyway,
Well, I have to go, you guys. Sorry, but I just had to cut in and say I have to go.
Thank you for coming, Jocelyn. So
I'm
happy
coming
to
back
see
later,
you.
but I'll see you guys on Friday. Okay.
Absolutely.
Bye.
Bye-bye. I mean, as far as what everything Hannah said, I mean, it really sounds like you're doing it right as far as planning and contemplating every aspect possible, because the less you have to worry about, the better. And that's way more than seizures when you're pregnant.
Before I had kids, I didn't think about any of that stuff. I didn't worry about having a seizure when I was pregnant or delivery. After I got pregnant, I started worrying about that stuff. And so I went into it really just dumb about the whole situation. Because when I got epilepsy, I was just like, okay, whatever, blah, blah. And then I got pregnant. I was like, okay, this is going to be good. I'm a normal person. Because I wasn't having them that frequently. And then, and then as time goes by, you start to realize the realities of it. Like, I remember the first time that I had a seizure when I was home alone with my kid. And like, because I just have tonic-clonics, and I just remember like becoming aware, and he's like a 3-month-old sitting on the floor, and I was like, oh my God, did I have a seizure? And I was never really sure, but I mean, I had all the symptoms like being confused and like, and I was like, that's scary.
that's
It was really
terrifying.
scary.
I
But
just
I don't know, you just set up your safety parameters, you teach your kids from an early age, like how to take care of you, first aid and emergency, how to make phone calls and stuff like that. And I mean, if you have kids, that's all you can do. I mean,
I'm sure my husband would be just fine handling that. I'm just like Kate. So, Katie, when you had your seizure when you were pregnant, like it didn't hurt your daughter at all.
Right. So 3 pregnancies total, 2 full term, and each pregnancy had 5 tonic-clonics that lasted at least 5 minutes, and the usual 2 or 3 partials each trimester, or each month rather. And they've come to the conclusion that there were no, that that the son is 4. He was born in 21, and he's developing. He's really tall, first of all, but mentally,
Mine's little.
I gotta believe him when they say he's all the way there, but he's a boy. Good God.
I know
Yeah,
that.
other than that, I mean, he's talking. He's talking enough, and he's definitely functioning at, and as expected for a 4-year-old daughter. Surprisingly, during COVID, she was in 5th grade and switched to homeschool. We left the K-12 in Florida because it's the stereotypes are true, and now she's doing an online home education program out of a school in Washington State, taking advanced classes. She's in dual enrollment at this point, or not dual enrollment. She's on track for dual enrollment rather. Got a couple of high school credits last year, and she's starting her freshman year in a couple of weeks. So I
So
think it's safe to say that there wasn't anything. I was on carbatrol for the first pregnancy, the duration of it. The second
you were on
pregnancy,
what?
it was a carbatrol. It's an extended release
Okay.
capsule that I think they don't make. No, they do make a generic for that one.
Are yours generalized?
Both.
Me too.
And the second seizure, or the second pregnancy rather, was the ectopic. I was on clobazam and Ficomp. It was a little bit of a cocktail for that one. I know it was 2 80s and a benzo, and
Yeah.
that's what we figured out after the fact is what just killed the effectiveness of the birth control. And that was first trimester miscarriage, so I didn't know I was pregnant, but I, again, looking back,
Yeah.
had worse seizures in the weeks leading up to that. I wrote it off as like, around the time of the flu shot or something like that. That's the same year I stopped getting flu shots because vaccinations are another trigger for me. And
Wow.
yeah, third pregnancy, Keppra, the generic Keppra levetiracetam, the duration. And it was at a high dose initially when upon conception. I think I was taking the max dose of 6,000. RNS, however, was already just activated, or they had adjusted the settings at that point. And I'm not proud to say, but I took it upon myself to let RNS do its job. Essentially, I got off of the clobazam, titrated myself off the clobazam, and
Don't blame you with that clobazam. That shit is like, but that's like the only medication where if you stop that cold turkey, it can kill you.
so I kind of titrated myself off it. They give you those really small capsules to start with. So yeah, I would never recommend anybody else do it like that, but I just felt so unheard by any and every neurologist that I was seeing. And the Keppra now I'm taking half of a 250 milligram tab twice a day, where they have me prescribed to take 3 tablets twice a day.
Clobazam's as hardcore as you can get, pretty much. That's like taking Klonopin every 10 minutes all the time.
Yeah, but that's why I feel so much better off of it. I
Yeah.
have some energy back. I'm getting things done. My
I used to be on the
short term
clobazam.
is there.
That shit was, I couldn't do it. I could not do it. I had them take me off of it almost immediately.
That's what I did with Ficompa.
I can't do Klonopin. I have an adverse reaction. Instead of crashing me down, I get super, super, super high. And when I get high, I get hyper.
Hmm.
And
Yeah, those medications are really concentrated. They're strong.
yeah, I was having hallucinations. I had my dad just took it twice, once in high school. My dad had to come pick me up, and once when
What did they use for your rescue?
I don't,
You don't have a rescue? What kind of
I
seizures
don't,
do you have?
Fogels and tonics.
And the
Um, uh,
tonics, do they last any longer than how long do they
they
last?
30 seconds to a minute,
Oh, okay.
which they used to before my surgery last anywhere from 2 to 4 minutes.
Which surgery?
Oh, I got I'm in the question mark club.
Oh, the RNS?
Nope.
Oh, no, the that's a brain
Right
where they
temporal lobe
lobectomy?
resection. Yeah, lobectomy. Yeah, that's it. Um, and basically, I have a bubble in my brain. Actually, it's filled with liquid. It's a liquid bubble. Um, I forgot where I was going with this. It was no. There was something I really
We
wanted
started
to
off with the
tell you.
Klonopin, and then
Rescue
started talking about
medications.
yours. Yes, there you go.
we
That's wild. I can't even imagine not having my Klonopin because that's whenever I'm starting to because I don't officially they say I don't have auras. They say that it's the psychogenic, but anytime like I've kind of identified when I feel weird and sometimes I'll have a seizure after and sometimes I won't.
sometimes you won't.
And because I didn't, they're like, okay, well, it's not, or because I don't know. I don't know. I just know that I know my body and I know when I feel weird and I feel when I take my Klonopin when I'm feeling weird, then I feel better and I can go back to doing whatever I was doing. My last seizure I had on Friday was in the middle of a exam, the entrance exam for nursing school. They
Oh,
had it on video and I was taking it for the second time because I was trying to get a higher score. The first time I got an 89, I was trying to beat 90. So
89's still really good.
it was still really good, but another reason I was taking it is because my power cut out in the middle of the test the first time. And so I didn't think that they were going to take it because I was doing it online, like the proctoring online classes. And so when my power cut
Oh,
out, I logged back in and I
no.
kept taking the test and I didn't think that they were going to accept that because my power went out. So I took it again. And then after the seizure, when I called, like I finished the test, I had the seizure, finished the test like 3 hours later, and then called
Oh
in and said,
my.
I'm so sorry. I had a seizure. You can trust that I had a seizure because it's on the video that you can see. And the woman, like I was talking to, she was
I'm
like,
sorry.
what the fuck do I say to this? I'm so sorry. I'm gonna make sure they take that first test. We're gonna make sure you take that it's okay. You don't worry about a thing. We'll take care of it. I'm like, okay, cool, thanks. Any chance I can get my $250 back? No, but it is what it is.
Oh, that sounds like an unwelcome timing. But isn't that the timing? Like what's notorious about these?
It's the worst timing.
Yes, always. It's
Anybody
never a
have
good
a
time.
head-sized hole in their wall?
I'm not sorry for laughing at any of this. I like to laugh, and I rather see humor in stories than not. But oh,
That's where parenting comes in useful.
yes,
One pet,
exactly.
guys.
Like you see him doing something. It's like, oh wait, this is going to be hilarious.
Oh, that's
Yep,
another
yep. He
reason.
started eating it.
Okay.
What are you doing? The same child that will not eat anything on his dinner plate
Yeah, I should not still be
is
breastfeeding.
it's Oh no, I should
Yeah.
have seen it coming because the boy was so picky he wouldn't latch.
Oh, okay.
Yeah. So sorry, I saw that from yeah. Um, the biggest kindness, or one of the biggest kindnesses I ever received, um, was I had Jeffy was newborn. I had just left my ex for the first time. I, what happens in Vegas stays in Vegas. This story leaves Vegas because it's a story of kindness.
So I work for the longest time I was trying to find where to work, that I would get like good leaves, I could work from home, things like that. And I ended up getting a job in prescription insurance. And I so I worked for Caremark, CVS Caremark, and work from home. And I've worked there for 6 years. They have awesome disability, pretty much approved anytime I can't work. It's just like, okay, don't just send a message, you'll be fine. And I can pretty much choose my schedule. But the real good, I mean, they're basic pay, but they have saved me so much money in me bullshitting and like working around my insurance. That phone call I just got, I told my insurance, because my insurance is about to switch in a month. I told them that I lost 3 months worth of my seizure medications and that I was like needing to get 3 months of my seizure medications, even though I just picked up 3 months. So I'm building a stock for and using my job to get free medication.
Hey, if it's not a Schedule 4, if it's not one of those controlled substances, then you could do that.
It is a controlled
You
substance, but
gotta survive.
when most people call in and they'll be like, okay, well, we can see if it is good for an override. They will say, no, we can't do it. It's a controlled substance. But because the regular people, they don't know, but you have to ask for a senior representative because they have the ability to make exceptions and manually place in those overrides. And so they can put in the override, they have the authority to do it, but the regular team doesn't do it. So they don't, so they tell you, sorry, your plan doesn't cover it, you go to the ER. But if you ask for a senior member, they can place that override for most plans. If most plans they'll make an exception for a controlled substance if it's life-threatening. You need the
Hey, at
doctor to
least you know
sign
who to
off
talk
on
to.
it, and you need the pharmacist to sign off on it. Most pharmacists don't have a problem giving out seizure meds. They'll be suspicious if you're trying to get a controlled substance loss medication override for oxycodone, but for Excopery, they're going to be like, okay.
Right.
So you just got to kind of check off the boxes. I've been learning how to manipulate my insurance to build up because I mean, if anything happens, money is not going to be very helpful. I need to build up a stock of meds.
Yeah, that makes
Yes,
sense.
that was my Las Vegas story.
You have to survive.
Yes.
That's a pirate.
I just felt so
That's the
satisfied because
pirate
I
spirit.
just got the call from CVS saying, yep,
Just
it's $20 for 90 days worth of medication and we're gonna give you it. And I'm like, awesome. I just wanted to tell. I was just very satisfied.
Did you guys get any of your energy back, per se, after, you were done with the breastfeeding and the pregnancy and all that?
I went into clinical depression.
Oh, or that. Okay.
Yeah, well, I had just been diagnosed with epilepsy. Just have a newborn who's not
Oh,
latching at all, and he requires the most expensive formula
Formula.
on the market because he has eczema that
requires something.
my poor dragon boy has scales.
Oh, okay. But
Um,
that's adorable that you found a way to make, let him know that that's nothing to be embarrassed about.
exactly.
Give him that nickname and raise him with it. That's perfect.
He is my dragon boy.
They
And I call him my dragon. Pookie's mom calls him Sunshine. Mine is Dragon. Um,
beautiful.
How did you
and
guys handle explaining epilepsy to your kids?
oh, very, very easily. Sometimes my brain and the kids are smarter than you think. They are. Oh, and brains spark. That's how a thought. That's what a thought is. It's a spark. You look at something
A
and you
really
think,
great way to put it.
I wonder what's
Oh,
on the
she's the
other side
author.
of the door.
You can tell. You can tell. Words is Toaster's strong suit for sure.
She's very
Yeah,
eloquent.
thank you.
Exactly.
Um, it the sparks in my brain sometimes will just spark way too quickly, and then it will spark another area, which will then spark way too quickly, and they're sending all these messages to your body. When you raise your hand, that's your brain saying, hand, go up. Mine is saying, hand, freeze, and jerk at the same time.
Does it scare your kid? Because I know, Katie, you said that your kids have
Daughter.
seen you have, yeah, your daughter have seen you have seizures
I thought it would,
a
but it doesn't.
bunch, but it doesn't scare them.
No, they're resilient. They are surprisingly resilient. And just being around me, I've had him stand up, and you have to have the hands in front of a crowd saying, "It's okay. My mom has epilepsy. It's all right." And
So
it's like you can't rely on your children, but a knowledgeable kid is reliable.
that makes me feel so much better.
One time
Yeah.
I was at the coffee shop with my kids and I had a seizure and my son, he's older than my daughter. I don't know at the time, he's probably 8 or 9 and not that old. Um, but I had a seizure and he was like telling everybody, it's okay, she has epilepsy. It's not a big deal. And my daughter was crying because she's younger and he was taking care of her. And then when I came to and like we were back at home and talking about it, all he was just so happy because they just gave him all this candy and they were so nice to him. And it was just like a highlight. And he was like, I want to go back there. Like in my mind, I'm like, I'm never going back there. I don't want to see those people.
Now, Clark Kent.
That's incredible though that you got to see some positive in that. That's brilliant. See, I've
I
always felt a little guilty about Talia having to mature so quickly.
Yes.
And I think she does use that to her benefit at this point.
Mine
But
tries to bargain.
absolutely, Titi knows when to bargain. But I appreciate how she explains it to little bro.
Yes.
She says this is just mommy doing her dance, and
Oh, yeah.
if she can't
I
dance,
that is actually very true. I'm gonna admit, if I didn't have my daughter, Jeffrey probably wouldn't have turned out as well as he has.
and mine have a 10-year age gap.
Because, yeah, I mean, she was hitting puberty when he was born. It's let's see, I'm trying to think of, she is turning 25 this year.
That's exciting. That's a
And
milestone.
Yeah, and Jeffrey's 9.
There you go. That's a hell of an age gap.
Yes. So she was definitely there to help, and just by her not panicking.
Yeah. Example. Lead by
Yep.
example for sure.
And of course, Jeffrey absolutely thinks thinks that his oldest brother is a walking god because Maddie lets me play on his Switch. It's like, you have a Switch here, and yeah, but I get to play with him. It's like, okay, I see what's going on.
There you go. Learn what to love.
Yep.
So this is a relevant chapter with all the stories that we read, or a relevant question rather, being that we read stories a lot.
Oh,
If
yes, we do.
your life was a book, what chapter would you reread? This discussion kind of made me think that mine would be, I feel really guilty saying my second pregnancy, but that's the one that I can remember better at this point, and I think I would rather relive.
What was the question?
If your life was a book, what chapter would you reread, Melissa?
Would I reread?
Yes, in other words,
Oh,
relive essentially.
oh, okay. I thought you said what chapter are you in right now?
Oh,
Um, and I was like, oh, I definitely reversed puberty. That would be my chapter right now. It's a horrible chapter.
so that would
And
be a rewrite for sure.
if we could
Right.
just
Yes.
rewrite, if we could just skip this chapter, I'd be so happy.
Oh yeah.
Um, I don't know. Maybe my whole childhood, because I don't remember anything. So that might be
That's
nice
true.
to remember what happened.
Absolutely. And I hate how I have to learn about my childhood from everybody else's perspective because I don't think it's accurate.
No, my sister does the same thing, and she loves, and she's big on like, um, I don't want to say dark humor, but she'll kind of pick fun at my seizure sometime, and she'll just to anyone who'll listen, she'll be like, "Oh yeah, I
I
had a
love dark
whole
humor.
book of things Hannah would say after she was coming out of a seizure." My favorite was, "I'm a man with a big appetite," and then she'll just go down and list all the things that I said during a seizure and like I don't know. She loves to make fun of that.
Actually, this sounds like
Okay.
a hilarious idea.
Oh yeah,
Now, only if the person you were writing about is consenting. That is the main thing,
Willing,
because it
yeah.
doesn't
No, I asked her
become
to
fun
write them
otherwise.
down. I asked her because
Okay.
she would tell me after, and then I'd keep forgetting. So she started to journal all the things that I would say. One time I came out of a seizure and I kept singing. I think I sang the Hokey Pokey for 20 minutes straight and didn't remember it. And I was doing the whole thing and just kind of like just laying there doing the Hokey Pokey. There was one time where I had a seizure just like last year, and I um got up like 30 seconds after I got up, said, "I need to go to the bathroom." And I wasn't at my house. I was at my friend's house, and my friend was like, "No, no, 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 no." And I'm like, "Shut up, bitch. I'm going to the bathroom." And I went to the bathroom, came back down, laid, and I woke up half an hour later and my husband was there, and I'm like, "What the fuck are you doing here? We were just watching The Bachelor. You're not this is the girls' time. What are you doing here?" He's like, "You had a seizure." I'm like, What?" But yeah, I mean, I've done all sorts of things coming out of a seizure.
That's impressive though that you get so many motor functions back so quickly. I
I
don't think
didn't
I would be
until
able
the
to do
vagus
something like
nerve. I
that.
just don't I would say things coming out of a seizure like when I'm postdictal, once
Mhm.
I'm kind of just coming out of it when I'm not really fully aware, but yeah. Now
And this
I
is
will say
unprompted. This is
and
not somebody
do
asking you
things.
questions.
Yeah, most of the time it's just me being really confused.
Okay,
Confused.
that makes sense. So when they got your VNS, what prompted the RNS?
Hmm.
I don't think I've ever met anybody with more than one implant.
The VNS brought the seizure severity down, um, to where it wasn't, because for a long time, they weren't trying to stop the seizures, they were just trying to keep me out of,
I seizures.
status.
Oh, right, right.
So for a long time, they were just doing that. I mean, they had me drugged every which way. I had tried 20 different drugs before I tried the VNS, and even when I got the VNS, I was on 3, and, the the drugs that I was on, they fucked up my kidneys so bad I got a kidney infection, and, um, all of the drugs and everything, eventually over time, I ended up, getting, like, kind of fibromyalgia pains and pelvic pains and just weird random symptoms that nobody could explain, sort of thing, and so they needed, and it still wasn't really controlling my seizures, so they just needed something else because the meds weren't working.
So drug resistant is probably something that's on your chart too.
Absolutely, yes. Not that I'm
Okay,
not on
that's
them, but still.
but that was my shoe in for RNS too, and I went to one of those
Yeah.
teaching hospitals, so it sounds like it was a pretty similar path. All
Yeah, at
right,
first they said they were gonna do, the DBS, but they changed to the RNS.
DBS is the one that's deeper, is it?
It's just pretty much the same thing, it just doesn't record and it's constantly going off.
Oh, okay, that was the biggest
It's
difference. It's
just
not
a
responsive.
constant instead of responding.
Got it. Well, I mean, do you feel like either one or both is actually doing their job? It sounds
Yeah,
like you said the severity did already go down, but is the
they've saved my
frequency
life, for sure.
okay?
The devices have helped, just the VNS has helped 100 times more than any medication has. So, I am all for the devices.
There we go. Beautiful endorsement.
So, if I ever get bankrupt, it's not like they can take it out of my head.
All right, good to know. That part's still going to be in the recording, I'm sure. All right, so another question here that might be relevant to us. It's a post. Somebody says dating is a joke. A 40-year-old female. I've had epilepsy for about 30 years. Never have I been able to have a relationship, a real relationship. Being well medicated comes with a lot of restrictions. In my younger years, I was on Keppra, and I used to have a couple of alcoholic drinks and stay up late and go to parties. I got hit on by guys, which was a surprise to me because Keppra made me extremely short-tempered. While I was a serial dater, my female friends were getting engaged, and I was too afraid to commit to someone because having a seizure isn't pretty. Fast forward to now, I'm on Briviact, which is a big change in how quickly I can get angry. Sound great? Not so much. Now I feel my emotions more. I get sad, cry, isolate myself because now I also wear hearing aids. I'm too afraid to be social and drink anything alcoholic, not that I ever really like it, but now I feel forever single. All right. So before we get into the comments, what's your perspective on that? You had the diagnosis. Did everybody here have their diagnosis before they started a love life? Okay. So Melissa, go ahead. What do you think? What's your perspective on this?
Um, I got diagnosed like a couple years before I got married, but I met my husband like right after I got diagnosed. And we dated for a long time. And I think after we got married, he says, I'm like, I didn't know if I wanted the responsibility of marrying somebody with epilepsy. And but we're already married, so he got unlucky. It was too bad for him already. So but I can imagine it being difficult to like find a partner when you're just trying to take care of yourself and your own health. And I know people that are in good health that have a hard time dating in their 40s anyways. The older you get, the harder it is. And I mean, I know a lot of people that are in their 40s that are or older that are single and they're happy. You can make a fulfilling life. It may not be what you expected
Or
or
what you planned.
desire. Yeah,
Yeah,
but you can still like have a full and complete life. And
absolutely.
I mean, and you know, it doesn't necessarily isn't just because of epilepsy. That's my
Yeah,
thought.
there's more to it than that, that's for sure. Like your epilepsy isn't you. It's a part of you, but it
Yeah.
doesn't define you. Yeah, that's a good one to remember. Hey Raven, if you're there, I forgot to ask you the icebreaker. Are you with us? Okay, we'll get back to you.
Yeah,
Yep.
I'm
Okay.
here. I couldn't get
Beautiful.
my computer to respond.
Okay, no problem, no problem. It happens. So the icebreaker today was the question of how did you feel about yourself as a woman after your diagnosis? You started having seizures. Did that change your perspective at all?
Oh, um, no, but I mean, I'm already like genderqueer anyway, so no, not really. No effect on my how I view myself as a person in
Beautiful.
that regard.
Yeah, that's perfect. Sometimes that is pretty hard to deal with for I think it's most of the ones that get diagnosed during puberty when you're already kind of unsure about yourself and getting comfortable in your own skin and now yeah, you have to watch out for a whole nother thing.
Yeah,
And as when it was associated with the time of the month for me and all that, then I was thinking if they put me on these hormones and I just go backwards, then am I going to be like, some little flat chested, like 10-year-old for the rest of my life? What are you actually going to do to me? And
oh
that
my
was another
gosh.
thing that did not help about the doctors never explaining something. They were so quick
Yeah,
to write a prescription, say, do this because I said so, and, don't drive anymore. That was
that's
as much as I got.
Pretty much having to do all your own research as a kid that doesn't understand the world anyway.
Exactly. And I'm
And then
thinking,
you're
okay, if they're going to take my license, I better get all the miles that I can right now. And that didn't turn out well.
oh
when I was younger, I felt almost guilty for having the seizures because I could see the stress that I was putting on the family, but because I wasn't conscious during them, like sure I had the injuries or whatever after, but it wasn't like it's they look worse than they are, sort of things. Like you don't really feel it happening until after. And so it's kind of like something that's happening to me, but I'm not part of, if that kind of makes sense. So I felt like it wasn't it was hard
Not
to
by choice.
yeah, but it was kind of hard to process for me as a kid because I wasn't experiencing it as if you know what I mean, but everybody else like I had a seizure at homecoming and then I was going to school normally and everybody was looking at me weird and things like that. Like it felt weird to process that.
Yeah, that makes sense. I mean, we say all the time we're not there when it's happening. It's the last thing that anybody could ever expect to think is that it's your choice in any sense.
So
And
what I
you're not there when it's happening.
so as far as like the dating and epilepsy, I didn't feel like epilepsy had anything to do with my dating life. It only brought into the date it only became a part of my dating life whenever I would have a seizure in front of somebody that I was with, and it was pretty much I'm like, all right, up to you.
And you
Stay in
had
or
your auras. Did you ever have the time to give some kind of warning?
no.
Okay.
My auras aren't really like they're not actual auras. They're just like, okay, well, I'm feeling a little off right now, so I'll lay down, but they're not actually like a warning. It's sometimes I'll have them, sometimes I won't.
Okay, that makes sense. Well, that's what got me thinking too. One of the comments here. This one is saying I'm 29-year-old male. My epilepsy isn't very well controlled. I finally quit drinking because I was in denial that alcohol made it easier to socialize. Now I drink non-alcoholic beers at bars with my friends. Found this organization called Phoenix that puts together sober activities like rock climbing and kayaking for free. I try to exercise and quit giving a fuck about my epilepsy. Like, sure, I could drown kayaking, but everyone has a time, and I'd rather die doing something cool. Reading the response from the male made me think it's just not that easy for a woman. It's just not with the stigma, and there's social expectations out there that if the woman has a seizure on a date without telling the guy, I feel like a lot more people would be on his side for being somewhat offended. But if it was the other way around, chances are there would be less on the woman's side if she was offended of like, why wouldn't you tell me or give me a warning of something like this? I guess that they would kind of have to break at the beginning if he asked her to drive, just saying I don't have my license.
I mean, I never really gave a fuck. I tried my best not to give a fuck about my epilepsy and to really not try to hide it, and because I figured it's nothing to be ashamed of. It's nothing I can change. I mean, but it's their decision if they want to be a part of my life. If they want to get to know me, that's up to them. I'm not going to hide myself from them. So most of the people when I was dating, I would tell them I was epileptic, but most of the time they just blew it off, didn't really think about it until they saw a seizure. And a couple of the guys that saw me have a seizure were like, "Oh yeah, I'm sorry, but that was just a little much." And I wasn't really offended. I just knew, all right, you're not the guy for me then, obviously. So, yeah, I didn't really think about it all too much in the dating aspect because I was pretty much just like, all right, balls in your court. Here's what I got. That's up to you. And I don't think anyone should be offended because I mean, people got to choose what's best for them anyway. If that's not, I mean, if you're looking to be in a relationship, you got to do what's best for both people.
That makes sense. So maybe my experience was more because my children's father is older. He's considerably older, and I think I was probably just fed that stigma of, just be silent and obey and whatnot and keep your seizures under control or else it's your fault. Melissa, from your generation, when you were in the dating game, were there any stigmas then about your condition slowing it down or impeding you at all?
Well, when I didn't have epilepsy till I was 27, so a lot of my dating times at the beginning were it just didn't have to worry about it at all. And actually, my husband is I think he's the first guy, maybe the second guy I dated after I got diagnosed. So I didn't have a long dating history while I knew I had epilepsy. Yeah, I think he was the first guy after official diagnosis that I dated.
Sounds like it
I
was
don't know,
meant
I
to be.
just got lucky, I guess.
Yeah.
But
And granted, I met my husband when I was 18 years old. So, I mean, I was a little slut before then. I was acting out because I was just I don't know. I was a confused little teenager, so I was acting out and I was a little slut, and that was my dating life until I went to college and I met my husband.
There you go.
I don't know if
That's
it's
one way to put it. What do you think, Raven?
I don't know if it's like a generational thing, so much as like just maybe a jerk thing, honestly, because my ex-husband would never have taken this seriously. He couldn't take any of my other chronic illnesses seriously. And he's my age. I'm almost 40. But my partner now is 15 years older than I am, and he's super supportive.
That's awesome.
So I don't know, but dating with all of the things is super hard. I would never be able to date someone now if I hadn't already met him 5 years ago.
Yeah, that's kind of where my mindset is at this point too. Not even I just don't feel the dating game right now. This divorce is close enough to over, but I'm not looking to get back in the game.
It's hard.
I
It's hard out
mean,
there.
intimidating is a way to put it. You know, with
Yeah.
the family and everything else, talk to you like a friend, treat you like a friend, and if it comes to that point, am I actually going to be the slut for letting you know I'm not looking for a commitment? That's still, that's
I'm
still
wrong
how
with
it
that
is.
either.
Just be empowered.
You know. So when you were saying genderqueer, were you with any women long term that kind of you had to break it to them?
Well, I was only diagnosed with epilepsy like 2 months ago.
Hmm.
Oh
Um,
wow.
but
That's
yeah,
incredible.
my I have some other neurological chronic illnesses, and yeah, I was in a relationship with a woman for about 3 years, and she was kind of a mix between like really supportive and understanding, and also like really, really frustrated that I wasn't like taking myself more seriously and being more careful with not overexerting myself and avoiding triggers and that kind of thing. So she was probably more serious about it than I was, but um, I was maybe not the most mature person at that time.
And do you think that do you credit any of that with the medication changes? Or were you pretty much on a consistent medication since your diagnosis, since it was so recent?
No, I do. You mean my ability to
Well,
take it
if you
seriously?
had, yeah, I mean, just any perspective on relationships in general, because what comes to mind with me is the clobazam. That's the most recent medication that I weaned myself off of, where I actually took the notes. And I would never have made note of, increased libido, but, on my, in my 20s. But now that's relevant to me. I understand that that is actually, showing changes in the body on hormones related. And since I'm pretty sensitive to catamenial stuff, I think it's relevant to take notes on. So since you had or mental conditions before the epilepsy diagnosis, I was wondering if other kinds of medications actually had an effect on your perspective for different aspects of your life too.
Um, yeah, kind of. I was on so many, like, I have cyclic vomiting syndrome, which is
Okay.
neurological. I think maybe Lufa, was it Lufa? Somebody else has it in the group.
Hmm.
And yeah, so when we were first trying to figure out what was wrong with me and how to treat that, I was on so
Maybe it
many
was Sia.
different
Yeah, no, I think
prescriptions.
you're right.
Yeah, the number of prescriptions that I was on were excessive. I mean, it was like I looked like I had 80 years, not 25 years to my life, when you look at my prescription. So the number, just like the sheer number of things going on in my brain made it really, really hard to think clearly. And I was just in general a really shitty partner because I couldn't keep track of things that I had talked to my partner about, um, like important stuff. And it made me look like just a really, really bad person. It made me kind of behave like a bad person. And I'm not a bad person. Once I got off all of those other drugs and managed some of my underlying I kind of came out of this fog and I was like, oh my God, like I was really awful. So I'm in a much healthier mindset. So I think that is contributing to my being able to be in a healthier relationship.
So that's helpful. Then you know what actually helped.
Yeah,
That sounds
too
like it
many
definitely
drugs
made a
at the same
difference.
time. And yeah, prescriptions. I mean, yes.
One thing to be aware of, though, when Hannah brought up the possible pregnancies, is that in an article that was recently released, I took note that high blood pressure in pregnancy, that I know that's a pretty common condition. They always test for. They'll monitor you for pretty closely through on your prenatals. But if you do get that high blood pressure in pregnancy, that's linked to an increased risk of seizure in children. And now I think that's something that's been suspected probably in the medical field for a while, but now there's enough studies to prove it. So at this point, I think if anybody has a pregnancy while being diagnosed with epilepsy, it's just more reinforcement that, like, the more you plan ahead, the better. So when or if something does come up unexpected, then you have all the focus necessary to dedicate to that and finding the best solution for you.
Yeah.
I did want to mention, Raven, because I heard that you said that you were acting different on medications. Because that happened to me. I got arrested, I punched holes in walls, I had like pretty much gone, like they had to give me psychiatric medications to calm me down after I had a reaction to, because I tried 20 different medications and I had reactions to all of them.
Oh my God.
And so there are periods of time, all of my memory is really foggy, but people will tell me that there were periods of time where like I had been tied down, that they would, like, my mom would just feed me benzos, things like that, trying to calm me down. And I always felt bad about it, but it wasn't me. It was medications fucking with my brain, making me crazy.
Yeah,
That's awful. I'm so sorry. And thank
that
you
sounds
for
I
telling.
traumatic.
just wanted you to know that you aren't crazy.
Thank you. Yeah,
You
I
should feel
felt
good
crazy.
about that.
And I was with an abusive partner at the time who was doing everything he possibly could to convince me that I was crazy. And I think I still feel like, I'm still responsible for my actions, even if I wasn't acting like myself.
But Raven, if you were taking care of someone, if your sister, someone had if they were on psychiatric medications that were adjusting what their brain, if they were not aware and oriented, you're not going to expect someone with schizophrenia to be completely aware and responsible for their actions. So why would you?
Well, I
If these
was
meds are
aware
messing with your head,
I was just making really bad choices.
that happens too. We all do that. Everyone does that. It just makes it a little more complicated when your brain goes a little cuckoo sometimes.
I
Well, and
really
it's even worse when you have that pesky partner reinforcing that it's all your fault, and you
Yeah.
kind of can't shake that mentality for years to come.
yeah, it's been about a decade. You'd think I'd get over it, but
I think we're on the same page on this one.
yeah. Thank you. I really appreciate your compassion about it. Thank you.
That's something that we truly understand. So there's never any shame in speaking exactly how you feel, because I know exactly how you get to that point. And still supposed to be raising children together, and I have to remind myself never to be proud of him for like holding a job for more than 6 months oh, I feel like such an idiot. But sometimes you just can't shake that mentality of like, take care of them. You're supposed to like
Yeah,
be what you're supposed to be, and that's annoying.
it is. It's oppressive.
Yeah.
It just gets really hard because we are trying to function in a world where everyone else's brains are different, and our brains are different. We're trying to function in normal brain world, and it just makes it a lot different because nobody that doesn't have seizures will understand. You can see a seizure, but even if you see it, you don't fully understand what it's like to have your brain work that way. And there's that disconnect. But I don't, you can't, it's just, you can't let that make you feel like you're not worthy or that it's your fault for being different. Because we're living in a world that doesn't really function like we do.
Yeah, that makes sense. Everybody is still their own, and we just have like one more layer on top of that.
Yeah.
Yeah, that makes sense. That's a good way to look at it.
Yeah, it is.
Were any of you informed about contraception interactions and hormonal adjustments recommended by the neuro, or was that always an OB conversation?
Mm.
I was recommended to OB, and then I went to OB and talked to OB, and they told me to talk to my neuro. So I pretty much just looked it up and told them I want an implant. So they didn't really fuck around at all with my hormones. I think everyone was too scared to touch it. They wanted the epileptologist to do everything in regards to the seizures.
Wow. So maybe that was a better course of action to just kind of get to the source. It sounds like
Yeah.
sooner than trying to adjust everything around it.
That's kind of been, well, when I first was diagnosed with epilepsy, I was doing all the 20 different meds, and each med would give me something different, like different symptoms, so we never knew what was causing what, and I was always on more than 2 or 3 meds at a time. So I was having all sorts of symptoms. They were changing my meds pretty much on a monthly basis, and they could never figure out what was causing what symptoms. And then I kind of fell into Zonegran, and um Zonegran was the main one. There's a couple others. I think Zonegran and Briviact and the CBD. I did that for a couple years, and I was still having symptoms, not psychiatric symptoms, but chronic pain, the fatigue, headaches, things like that. And they would do all the tests, racked up about 6 figures worth of medical debt before I finally just accepted, all of these tests are not going to tell them anything they don't already know. They just are not going to be able to figure out what is causing what with what they're doing. So I started to take it into my own hands, started to research different medications, look at medical journals, things like that, and got really kind of focused on taking care of myself, because the doctors, I can trust them to prescribe me the medication that works right now, but they're not going to really dig in and try to look at all these other symptoms that I have. I mean, I have all sorts of bullshit diagnosis, fibromyalgia, stuff like that, but they don't really know. They're pretty much just trying to say, look, your brain doesn't work right, you're having pain, but you're not, your body's fine. So get used to it. I've
So the medications that they're trying for these other conditions that are not officially diagnosed are really just seeing what happens.
well,
That's
yeah,
that's the
but they
vibe that
don't,
I got when I was on so many when I was on more than 3 medications. I got the impression that that prescriptions were just being written offhand and see if it helps.
Yeah.
well, that's what they did. The seizure meds, that's all they did is try this one, see what works, and we did that for years. And then we landed on that combo, and that combo worked but gave me horrible side effects, and we didn't know which one was causing what. And I stopped medication on my own just to see if I could figure out what was causing what, and I was still having the fatigue and the pain and everything. But pretty much I just got focused on, instead of letting my doctors figure out all this, why don't I? And that's when I started taking all the notes, trying to do my own trials, things like that on myself, and figuring out what's going to work for me, based on just doing what I can for myself. Because those medications, the ones that did work and they gave me the side effects, they fucked up my kidneys so bad that I landed in the hospital with pyelonephritis for a week. And that was like a month before my surgery for my skull.
Oh, wow.
Jeez.
Yeah.
Okay. Okay, so another one here. I mean, I'm getting the correlation that some people it's really hit or miss. Sometimes your neurologist and OB, like the team required for women, another pretty consistent theme that I see is that women with epilepsy have to have more of a team, doctors who do communicate to make sure everybody's on the same page. And I never got that vibe. For mine, it was pretty much the neurologist handling everything across the board. Did you guys ever have any other specialists that seemed more informed, basically, or willing to work with other doctors?
When I first got diagnosed, I feel like my doctors were better when the less complicated my seizures were. They were awesome. Like my neurologist, they handled everything, didn't have to worry about a thing. But as it got more complicated, they kind of backed away and said, sorry, this is above my pay grade, you need to see a specialist. I'm
So
sorry, I didn't mean to
that
cut you
probably
off,
helps.
Raven.
Oh no, you're fine. I don't even remember what I was gonna say.
We were asking something about whether the specialists that you have on your team ever actually.
Oh yeah.
Yeah, there you go.
Yeah. I see a specialist long distance in California, and they're really willing to work with everybody else. So
Yeah, that definitely sounds useful.
yeah.
Has anybody ever thought of epilepsy as having an upside?
Oh yeah,
Oh
Awesome.
really?
absolutely.
Elaborate on that, please.
Hell yeah. There's no better excuse to getting out of something or to making someone like feel like shit, or try to help you, want to get to help you, then, oh sorry, I didn't mean to miss that appointment, or I'm sorry, I had a seizure. Everyone just like, okay, I'm gonna help you. But not that I use that excuse. Most of the time it's not an excuse, but for school, just the diagnosis got me I double time on exams and tests, which was great, because when I wasn't having seizures, I would have all this extra time and I could use to study. And I mean, granted, it was necessary considering I had a seizure during my test on Friday, but I mean, just things like that. It helped me get it made it a little bit easier to get help from society, if that makes
Yeah, taking
sense.
advantage of any allowances that are out there. You might as well.
Exactly.
Yeah.
Totally.
And Raven, Uber, if you don't know, Uber it's either Uber or Lyft has a program, and your doctor can help you sign up for it. That they'll give you 2 free rides a month for any epileptics.
Oh wow.
Oh, that's not a state thing. That's like a national or a federal
No,
thing.
that's Lyft. Yeah, that's Lyft. It's either
Oh,
Lyft or
okay.
Uber. But they have a program within the company that if the doctor sends the information, and they say that those 2 rides are to get to and from doctor's visits if you need help with that, but they can be used for anything.
Wow. That's awesome. Thank you.
it's things like that that it kind of, it's nice to take advantage of, you know. It doesn't make it all better, but at least it helps us function.
Yeah, so
Absolutely.
that upside question came from this article here because I was surprised to hear about these things. That reframing epilepsy in terms of understanding, this is just a summary points here. Reframing epilepsy in terms of understand what is adaptive about seizures could lead to new research and therapies. So, I mean, it sounds like in the most part, a lot of what these therapies are concluding is that everybody's epilepsy is so individual.
It is.
That it really, there is never going to be some kind of cure-all, you have a seizure, this is what you do kind of solution. So I
Yeah,
do
no.
appreciate that, those points are being made. Also, they're noticing immune changes linked to epilepsy might offer protection against some infections like COVID. So did you guys have any kind of individual experiences with COVID or reactions different than others?
I never got COVID.
Same.
Oh, okay. Oh, Melissa, you didn't get COVID either?
No, I was so nervous though to leave the house because I was like, I don't want to even test it. Then nobody's talking about people with epilepsy and what their risk is with COVID. But like, I just was like, I'm not testing it. I'm not leaving the house. I'm not visiting anybody. I'm gonna groceries delivered. All that. I didn't leave the house for a long time.
Same.
Oh yeah, that was a long couple of years. I don't think I took notes of any more seizures during that time. I mean, I think the one time, the one or 2 days that it was like a fever, that I might have had a longer absence or a cluster. Yeah, I think it was one cluster, and that was the only thing. But can't help but blame that on the hormones too. I know your body, the hormones go crazy whenever you have a seizure or any kind of immune response.
My mom, she just like a couple months ago, she decided that she wanted to work as an EEG tech because of me. So
Oh,
she's working at the hospital that like everybody knows me at, like I'm in and out of. And so every time she goes in there, she's always telling people, oh, yeah, she's talking about me and to other patients and stuff like that. And I'm like, Mom, if my doctor is working, you can't just sit there and talk about me.
right, HIPAA much?
Oh, gosh.
Yeah, no,
Yeah,
I'm
but
proud of you for hearing about this nursing journey.
I'm just very glad that you reminded me to do this, actually.
Yeah, you kind of reminded me that I should have brought that. I'm not home right now, and I figured, what's a couple days here? But of course, with during the summer, there's no rush to go back home at this point. So I probably should have brought mine too.
I do mine about once a week.
There you go. Yeah, that's just another one of the setting, one of the reminders set along with medications on the list. That's the only way it gets done.
But I figure, like they're still going to get the information. I get that they're not going to have time to go over all of it, but every time I have like an actual seizure, like I send them a message anyway and tell them exactly what time, so they'll see it.
Absolutely. I was surprised to hear about this too. Seizures may trigger natural pain relieving chemicals that improve mood temporarily. Has anybody ever been in a good mood after a seizure?
No way.
I had a hard time believing this one. I mean, it's Wiley Library. It's a legit study, but
Told you about this. You put your right arm in, you put your right arm out,
that there you go.
yeah. You do the hokey pokey and you turn yourself about.
Perfect.
After
That's
a
the
seizure.
antidote we were looking for.
But Raven, I just want to mention, I spent years after I was diagnosed because I also had a whole bunch of chronic issues that they couldn't really put a finger on. I spent years chasing them down. Just I really, really hope that you're your best advocate, but you got to do some research because I have like 6 figures of medical debt trying to chase down each symptom and figuring I wanted to be like normal. And no one was ever able to get me to be like normal. I had to create my own normal. So if there's any advice that I can give to you, create your own normal, or else you'll be in 6 figures of medical debt. And now they're putting medical debt to hit your credit again. So
Fantastic. Wow. Well, thank you. Yeah, I've had a chronic illness since I was like 16, 18, somewhere in there. And so that's been a little over 20 years. And I've been bedridden for, I think, 3 or 4 years now. It's just kind of like you said, you have to decide, like, okay, this is what life is going to look like, and that has to be okay. Because otherwise you're going to go bankrupt and you're going to go crazy.
It's a hard line to draw between being your own advocate and creating that normal, because you got to know, like, all of these tests and all the tests that they have done, and there's no point to do those tests again, but at the same time you still need to have them, like, you need to know what they can do and what they can't, and if what they can do is not really going to be helpful, if they've already done it and it hadn't done anything, then there's no point in getting it done. It's a hard balance.
Yeah. You have to make choices.
So Hannah, you seem like a well-informed woman. I wouldn't be surprised if you got into this argument too. Did you ever ask RNS for your data? Being able to review your own data. How far did you get with that?
They said that I would need to fill out a form, as well as talk to my doctor about it, because the doctor has most of the data. I haven't followed up on it because my appointment is coming up and I was going to talk to him then. Especially because my mom, she's studying EEG now, and she wants to see mine now that that's what she took the class to do, is to be able to study my EEG. So we definitely want to get that for her. They haven't said that I can't get the data, but they definitely have put up a lot of hoops.
Set up a paper trail, like
I just haven't taken the
obstacles.
time to jump those hoops yet.
Okay. Well, I mean, at least I laid out the groundwork for you. I hit a brick wall. It was just, it's not yours. Don't bother. They told me that I wouldn't. I think the last conversation left me with the impression that they were trying to insinuate that why are you bothering asking for your data, because you're too dumb to read it anyway. You wouldn't understand it.
Jeesh.
Yeah. No,
Yeah.
You're not going to get anywhere with NeuroPace themselves. You're going to need to get that from the doctor.
Okay.
And some doctors will be able to, like, download a part of it and just send it up. They're not going to be able to share the entire software with you, but they can
So I was
share
overreaching,
parts.
thinking I would just get the login.
Yeah, they'll just give you just parts of it. I mean, they can download specific parts and give it to you, but they have the same tablet that we do. It's just registered as the physician.
That's what I mean. I just wanted that login to be
They're
able to
not
see my own.
You're not going to be able to see it 24/7. I mean, if you want to request it, you have to request a specific piece of time that's being recorded.
So more hoops to jump through for sure.
Yeah, just more hoops.
And when I'm sitting here thinking that was a funny feeling, I wonder if that was, and I would have to jot it down. And that's usually not the first thing that comes to mind, is record the date and time and then ask for the data until like the next day if I have a worse one and I'm thinking, oh wait, yesterday I did feel kind of weird. But
Isn't it hilarious that we don't own our brainwaves?
You know,
Yes.
that's the impression I get
So
too.
weird.
Now, about that natural pain relieving chemical, though, I guess I can look back and see the logic in that one. In one of the worst ones last year, this came from the half bath. You know, the wall and the sink and everything was pretty close together. So this was definitely on the way down. And afterwards, I don't remember pain. I didn't make note of pain. I don't think I've ever had like a lump any bigger than this one was on my head. But I felt the pressure. It did not feel painful. Like honestly, I think it hurts more when I stub my toe on like while vacuuming. I'd scream louder with that than I did for something that clearly should have generated more pain. So maybe those seizures releasing chemicals to improve mood, then I guess I could see the logic in that. Anybody else
Don't
ever
doubt
had
it
an
at all.
injury during a seizure that didn't hurt as bad as it should have?
Yeah, because I've had a lot of those. I mean, I've even had a seizure in a pool and then woken up after when I can't breathe. And I don't remember it scary. I remember coughing a bunch and coughing up blood and laughing. And my husband was looking at me in horror. He was like, okay, well, Medical City is closer, but UT Southwest, do you want to go there? Like, where do you want to go? And I said, take me to UT. They'll give me the better drugs.
So you actually had a sense of humor after a tonic.
I was not scared. I was not freaked out. And you would think I'd be scared because of the fact I couldn't fucking breathe. But I was just sitting there like coughing, just like on top of the world. And I remember
Wow.
walking into the ER and everyone's just like coming round towards me. And I'm just sitting there like waving at everyone with blood coming down my face. And I'm just like, hi. And they're like, oh, you
Wow.
in so much pain. You must be feeling awful. Here's some this will calm you down. And I'm like, okay.
So do they have a
Wow.
diagnosis for that? I mean, a post-ictal state where you're like that happy. That sounds like something.
I mean, it's always been coming out of a seizure for me. It's always been it's almost like being on, and it might have something to do with the rescue meds too, because the midazolam, those benzos, they make you loopy. But probably that in combination, I've always come out of a seizure. The pain for sure is I can tell because they don't give you pain meds after a seizure for, that's not a rescue medication, but I've definitely had injuries where I should have been feeling something and I didn't.
Wow, that's impressive.
Like this one.
Oh, yikes.
That looks painful.
Yep. Didn't feel a thing.
Wow. And that was some kind of just blunt force trauma, something fell on you?
I don't know. I was sitting in a chair and then the next second I wasn't.
Oh,
I
one of
was sitting
those.
in a chair taking my exam and got stuck on this, and it was just like a really easy algebra problem. And I was sitting there staring at this algebra problem, like, what the fuck? Why my brain is not processing this? Why? And I was just looking at it and nothing was coming in. And then I woke up and my dad was like, yeah, you had a seizure. And I'm like, you gotta be fucking kidding me. But it worked out. I'll be right
Yeah,
back. I
that's an
gotta go
easy way to
grab a
tell.
charger for my computer. I'm almost dead.
We'll be here.
And actually, I won't be. I'm gonna have to go.
All right, Raven, thanks for stopping in. We'll be on for
Thanks for
20 more
hosting.
hours.
Bye.
Yep. See you soon. So the last point of this summary was that seizures may activate brain repair systems that enhance resilience to injury and disease. So it sounds like maybe in the future, I mean, do you feel that way, Melissa? Like over time, you've become less susceptible to injury and disease since being diagnosed and having seizures?
I mean, I've never thought of that before.
Yeah, it's never something that's jumped out at you.
Uh,
Yeah, I think that study sounds like they were really just trying to
Like, what question were they asking for the study? Is that just what the results of the study were? But what were they asking? You know what I mean? To be,
That was the objective. It's the first paragraph is we explore the idea that epilepsy may activate the brain's natural repair systems, despite
okay.
its risks. These include brain processes that help people recover from injury, infections, and reduce pain. Understanding these less frequently discussed aspects of seizures may help researchers develop novel questions and improve treatments. So it sounds like the big picture objective was to get, this information to researchers to actually be able to use it. And, it's far from accomplishing anything yet, but
I
it
don't know.
sounds like
That
they
seems like
do have a link.
a dumb question to ask out of, like, for me in my mind, like for them to be like a dumb objective, because I can think of like a million other things that I have questions on in my mind that you don't have a lot of studies out there about, that
True.
I would rather find out more about than like, is epilepsy going to heal your brain? Or
What the vibe that I got is that if they're exposing the adaptability of the brain, would you be surprised to find out that they somehow flip this around and try to turn it into an aging thing? Try to figure out a way to program something and bring it back and say it's for memory, but then just market it as some, you want to be younger. That's
Mm.
how I'm so disgusted at them using real data sometimes, but it happens every day.
Like
What it
my
comes down
biggest,
to, oh, sorry.
that's okay.
I think
I
what
was
it
just,
comes down to for at least the way I think about it is that they just don't know. There's so much that's not known about the brain that they can't really make any conclusions for a lot of things. I mean, they don't know so much of most of epilepsy is just throwing darts and seeing what lands. So that's it kind of leaves us with not much. It's just a mysterious disease in general.
Absolutely. So when you got your oh, Melissa, what were you saying?
I was just gonna say, of all the studies, I wish they would do a lot more with like women and epilepsy. Like just
Absolutely.
specifically women and epilepsy. Everything's generalized for like all adults or all children, but there's not, I don't think there's enough information out there on women and the phases of life, puberty in
Exactly.
girls, perimenopause. I was looking up the other day about like taking um hormone replacement therapy in epilepsy, and there's a little bit of information, but everything was like, we don't know enough to like really say if it's good or not. And it's like, there should be more information out there by now, a little bit more. I understand the brain's complicated, and I understand that it's not easy to figure out, but they should be trying a little bit harder.
Oh yeah.
I definitely agree that they should be trying harder, but as far as um epilepsy studies are so hard to put together in general because epilepsy it's such a wide variety. All sorts of seizures are different. Some people have them more, some people's are more severe, some people's are, that it's trying to get a whole bunch of women that have seizures that all their seizures look alike,
And they
and
do
and
eliminate so many people from a study if they don't fit the bill.
exactly.
Yeah.
So it's not really like, how are they even going to study this when they don't have the information they need to even study it?
Right.
Mhm.
So I mean, I feel like because epilepsy medications they do help the majority of people, and these devices that are coming out commercially, they have what they need to at least manage. So there's no point in them spending all this money to try to find out what all this information that I mean, it's not going to change what they do for it anyway.
I think for me, since I'm in perimenopause, I really want more information out there. There's like nothing. There's nothing out there really. I mean, there's stuff out there, but hardly anything about perimenopause specifically and epilepsy. Because I'm always like, and they don't even have a lot of information on average normal people without epilepsy and perimenopause. Like, it's like a whole subject that is like brand new for people talking about at all in general. And I don't know, it's upsetting for me because that's where I'm at.
Yeah,
I feel like
yeah,
I'm always
absolutely.
gonna have that question in the back of my mind is what I'm feeling normal? Is this what normal people feel? Or whenever I have a symptom, is this caused by this or what, you know? I'm never gonna have that. I mean, our brains aren't normal. We don't know
Yeah.
why. We
Exactly. Your
don't know what
version
it's
of
doing.
normal is yours.
I've been
We have no idea what the perspective is from the normal side, and the normal people don't understand what it's like for us to be. So it's that complete disconnect. I mean, no matter how much research they do, that's not going to go away.
Yeah, absolutely. So welcome, Lufa. Thank you for joining, of course. Lovely to see you. The question that we first asked today when everybody joins is, how did your epilepsy diagnosis influence how you feel, you know, as a woman? Did that change your perspective on anything when you were diagnosed?
No, it just made my life as a woman harder. Especially with the like feeling aspect of it, because during my period it gets really, really bad, and I become a monster to society. And I think that my epilepsy plays a huge role in that.
All right, Melissa, you know, we'll be here. See you in a bit.
So yeah, that's
Yeah, I think it probably makes a difference too between on like what stage in life you were diagnosed at. I think me and Hannah were diagnosed around the same times when it was like puberty, like high school
Yeah.
ages, right? What about you, Lufa?
you guys.
30.
No,
Three.
how old were you guys when you got diagnosed?
Oh,
Sorry.
I was 16.
Okay. And how old
That
were
was the diagnosis age, though. I was probably having seizures for a little while before that.
Okay. How old were you?
Was diagnosed at like, I think 12 or 13, pretty much as soon as I started puberty.
Okay. I was diagnosed at 20, I think. Yes, 20.
There you go.
I'm 20 now.
Okay. So you got to have some of your fun teen years.
Yeah, I've been
You
having,
just get diagnosed?
yeah, I just got diagnosed.
How
But
old are you?
I've known that I've had epilepsy for a few years now. They,
Okay.
tried to do the little, why is this not working? They tried to do the PNES, BS,
I
and
have that. Yeah, they tried to pull that with me too.
they tried to say it was part of the tardive dyskinesia that I had from a medication side effect, but it didn't go away.
Trying to explain it any way they can. That
Yeah, anyway,
Yeah.
so they don't have to add on another
yeah.
type of doctor to the insurance. Why is this not working?
What is that? Is that mascara?
It's a cat laser, but it won't. won't.
You've been
Those are
like
tricky little things.
you've been fidgeting with that thing for like 5 minutes.
I will make it work.
But I got when I was diagnosed, had the first seizure I actually had a seizure. My mom told me I was 6 months old and had a seizure from, like, having a fever, and then the next seizure after that, I was 12. The first tonic-clonic seizure I was 12 years old, and they didn't know I had epilepsy because they didn't know I was having those absence seizures, and, so I had a seizure outside of my vet's office, and the vet came outside, called EMT, sent me off, and I went to Children's Hospital in Dallas, and the neurologist was talking to my mom, and my mom, like, they had finally gotten me to they had, like, gotten me out of the cluster. They got me out of status. And when I was, like, kind of awake and talking to people, my mom talked to the doctor and was like, "Hey, so she's fine now, right? She's talking to everyone." And the doctor said, "Well, there's no one home. The best way to explain her brain right now is this." And then he just went, and that's how he
Wow.
explained it to my mom. But so they didn't I was diagnosed with epilepsy first, and then years later was diagnosed with the psychogenic seizures because they're like, "Okay, well, press the button if you feel weird." All right, sure. All right, you have psychogenic seizures. Nice to see you. Bye.
And that was an ER thing, or that was an actual inpatient sleep study type setup?
It's the EMU.
Oh, okay. So that reminded me of this post here. Somebody saying, I had my first non-epileptic seizure after being brought out of anesthesia. They woke me up too fast and caused my brain and my body to disconnect, resulting in a 2-hour seizure. I only remember hearing a doctor voice saying, wake up, and then waking up on the floor. The neurologist said, I'll probably have these for the rest of my life, which sucks. So this person is saying they actually got the diagnosis of epilepsy after their first seizure being brought off anesthesia. I didn't think that was how it works. You know, if they're saying that
Doesn't sound like epilepsy. That
Would you
sounds
be
like
allergic to the anesthesia?
that's
that
what a
sounds
lot of
like a
the
reaction to the
yeah.
anesthesia. That's like a not just an acute reaction. It doesn't sound like epilepsy though.
My mom is allergic to high morphine.
Hydromorphone?
Yeah, like if she like the shit that they inject you and make you all fuzzy, whatever.
Dilaudid?
Yeah, all that fun stuff. Because she had 16 jaw surgeries, so she found that out. And she stopped breathing. So it could very well be a reaction to the anesthesia. Also check what type of anesthesia it was, because they do different types. Now I don't know what type of surgery they had, but I had a really bad reaction to an anesthesia knockoff. It's like a benzo anesthesia. I don't know what it's called, but it made me so sick. It made me,
Versed?
I don't know, but it was curse it. Curse it.
There was a
Negative energy gets way.
I have a bad reaction, and it's funny because it actually I have a bad reaction to anything that's similar to Haldol. Um and Haldol is like a medication, like they kind of tranquilizer sort of thing. I think they gave it to me in the ER once for I'm not sure if they were doing it off label for pain or what they were, I don't know, but they gave me Haldol, and the reaction I had was called akathisia, where my body was involuntarily moving like a seizure, but I was completely conscious and could not stop moving. So I was
Oh.
sitting there like, oh my God, I can't stop. Please help me. Please help me. Like, knock me out. I can't stop. And I just sat there like that for like an hour and there was nothing that they could do.
Wow.
That sounds like the opposite of what I had, which was I was on Abilify, which is an antipsychotic, I believe, and it gave me tardive dyskinesia, so the muscles in my eyes would get stuck rolled to the back of my head for hours, and I couldn't do anything with it. And we couldn't do anything until they came back. So
Yeah.
I was the girl from the TV. That was my nickname.
What's the problem with a lot of these chronic stuff is that most of the time, if it's not a quick fix, it's pretty much you got to just get used to it or figure it out yourself.
Yeah, and they never really try to personalize it for you.
Well, I
Hey,
mean,
Lupa,
they
are
don't
your
have the
seizures
fucking
catamenial?
time.
Yeah. When you're talking about that patient to doctor ratio, that is pretty difficult. So what we were talking about for a while at the beginning here was catamenial seizures. Are you more sensitive around hormonal changes?
I'm sorry, me?
Yeah, are
Yeah,
you catamenial?
she said hers what her
Oh, okay.
Oh, yeah. We call her Period Olivia. She is nuts,
That's what it was. Yeah.
crazy. She's insane. Like genuinely, like if I don't have my, what is it called? What's the birth control called? It's
A pill or an injection or
she's in
a
me.
IUD? IUD.
IUD. She's in my uterus. It was very
Mhm.
painful. Mirena, the Mirena.
Oh, okay,
It
there
was
you go.
so painful. But
Yeah, I have that.
as painful as it was, the benefits equal the amount of pain. So it's just as good as how painful it was. So that was a lot of
I
pain.
mean, is it still painful after the implant or was it
No.
just the Oh, okay.
No, I don't get my period at all.
It's like a 30-second pain when they're doing it.
No, I don't know if she did something wrong. I don't know if so I've always had problems with my uterus, and in my opinion, I think something's wrong. Because I would get my period for 6 months at a time and be like heavy bleeding, and I couldn't wear tampons because if I wore it for over an hour, I'd be at risk for what is that called?
Like where you lose too much blood?
Shock syndrome.
Yeah.
Because it would be so full already. I slept with diapers on. I couldn't go to school because of how much I was bleeding. So in my opinion, I think something's wrong with her. But when the lady put it in, they were like, it looked horrifying. I'm not gonna lie. Every time I've gone to the gynecologist and they put a speculum in, it is the most painful thing in the world. It does something to the soul. And
Do you have chronic pain like just on a regular in the pelvic area, like around your periods?
I have it all the time. There's some days that I don't have it, but most times I do have it. But the pain before I got the Mirena IUD was like unbearable. I would compare it to like contractions, because I'd literally be like a woman having like I've watched videos of women having like contractions, and I'm literally in the same type of position doing the same thing. I do the face down, ass up all the time. But it's like my part of the problem was because I tried the one on my arm, but I needed the bleeding to stop. And when she inserted it, it was so painful. It felt like I just paid to have myself essayed. And it was so, oh my God, I could feel every inch of it.
That sounds like it took way too long.
That's interesting because I
Yeah.
have pretty much the same symptoms exactly.
Yeah, no, it was, I felt every single part of it. And she's looked at my mom and she was like, should I stop? And my mom was like, no, like just get it over with. You're already inside like the area, so like just get it over with. So, but ever since then, my period stopped. I get some spotting here and there, but they say it should last till I'm 30. So, but I don't know. But
So they're calling this a condition that's going to change with like your life stages?
what?
I mean, how do they say predict that this condition's going to stop in your 30s? Are they saying like when you enter perimenopause or like a different life stage?
Well, they're saying the Mirena lasts until I'm 30. Like it
Oh, okay, that's what they're linking it to.
30. I think that there is something wrong. Like
Well, if it sounds like endometriosis.
That's what I've been saying, but
because I had that same thing, and they pretty much said, yeah, it's probably endometriosis, but the only way to confirm that condition is through surgery, and the surgery typically makes things worse. 10% of people, 10% of women, I think, or more have endometriosis, and even higher, I think, with epilepsy. But I have that was the reason, because I have the chronic pain in the pelvis too, and that's actually when I had Katie, you know how I told you the medications were hurting my kidneys and I got that kidney infection?
Yeah.
It spread throughout my body and I didn't even realize that I had a kidney infection because I was so used to the pelvic pain that I didn't think anything of it when it started to get worse. I took I had a oxycodone or something, like I'll stockpile meds or something, like if I have surgeries or whatever. So I took an oxycodone and kept going. And then my dad was
Your
like,
liver
hey,
felt it.
you're
Your kidneys
need to go to the hospital. You have 104 fever. So I was like, all right, let me take this test and I'll be right there.
Yeah, my friend has endometriosis and I call them PPV because I call them pussy popper Vicodins because that's exactly what they are. And I have my ghost period still, so I still have like that time. And it's never like the thing with my period too is the cycle is like whatever it wants. It's on its own time. Whenever, whoever, however long it wants, however short it wants. It could be it could be a day, it could be months. I don't know. So every time that they would tell me to track it, I'd be like, I don't know what the fuck to tell you. So I tried the PPV and oh my lord, it was like,
Do you know the name of that drug?
I don't know, but it was like Vicodin, but you put it up your coochie. And it was the most beautiful feeling in the world. It was so great. Like that should just it was great. It was very nice. My friend has endometriosis and she was like, try this. And I was like,
Sounds like estradiol. 1 second.
yeah, I don't know, but I loved it. It was great. It took the pain away and I was like, I didn't even know you could feel like this because it always hurts. It always hurts there. It always hurts in that area. And I just learned to live with it.
I want to try that PPV because I've been trying to get mine under control for a very long time. And I just figured that's not going to happen. But
I honestly don't know what to do about the endometriosis because
So you said the only way to diagnose it, is actually getting the surgery.
yeah, and I don't want to make it worse.
And that's the reason they don't typically do the surgery. So they don't even diagnose it most of the time because the surgery to diagnose it typically makes it worse.
Yeah, I
So
don't
it's
want
one
And
of
to
those.
scar tissue.
I don't want to yeah, because endometriosis feeds on scar tissue. I don't want to
Gotcha.
make it worse, and the Mirena IUD right now is doing the best that anything has done. So it has helped tremendously. So it was very painful to get inserted. It was not painless, but totally worth it long term wise. If you
Understandable.
don't deal
I
with
feel the same way about my brain thing implant. I mean,
Yeah, that's how they sold it to me too.